Hi, my name is Abby Rockers. I'm going to be performing how to do a breast self-examination today. And I would walk in the room, provide privacy, knock on the door, and wash my hands, introduce myself. Hi, my name is Abby. I'm going to be your nurse today.
Hi,
Can you give me your name and date of birth?
Shelby Folk, 9/14/96.
Great. Can I check your wristband there? Awesome. Okay, so we're here today to show you how to do a breast self-examination. Have you ever done this before?
No.
Okay, great. Well, it's really important to learn how to do this because early detection is key in finding any kind of breast cancer, okay?
Okay.
All right, before we get started, I have a few questions for you. Have you ever experienced any lumps or bumps on your breast?
No.
What about any pain?
No.
Any nipple discharge
No.
on either one? No. Do you have a history of breast cancer in your family?
No.
Okay, great. Okay, so I'm gonna get started on this. So what you're gonna do is first, there's a few different steps to this process, and it's kind of lengthy, and I'll give you a handout so you can use that when you get home. But I'm just gonna show you now. So what you're gonna do is you're gonna stand in front of your mirror, and you're gonna put your hands on your hips, and you're gonna look in the mirror, and what you're looking for is just to note the size, shape, and color of your breasts. You're also looking to see if they're evenly proportioned, if they're swelling in one or the other, or if there's any kind of distortions. The things that you're looking for, abnormalities that you would need to report to your doctor, are if you see any puckering or dimpling in the breast, or if you see any bulging, in the case of like a lump or bump, anything like that. You're also going to be looking to see if the nipple has changed position, if it's distorted, if it's inverted, anything like that. You're also going to want to note that too. So after you're done looking at all of that, you're going to raise your arms up like this, and you're going to do note the same changes that I just mentioned previously. What you're also going to look for is to see if you see any nipple discharge in one or both of your breasts. And this could be watery, milky, a yellow color, or bloody. It could be any of those.
Okay.
And those would also be things that you would need to report to your physician. Okay, so after you've done all of that, you would lie down and feel for any abnormalities on your breast. So some people start in the middle, and you start off smaller, and then you get in bigger circles as you go. But what I have found is what most women prefer, and probably the best way to do it, is by use your 3 fingers.
Okay.
And what you're going to do is use the flat part of your fingers. And you're going to go up and down in rows, kind of like you're mowing the grass, all over your breast. And you want to cover from your clavicle to the beginning of your abdomen, and then from your armpit to the middle of your cleavage. Okay? And what you're going to do is you're going to use your 3 fingers, and you're going to start on the outer edge like this, and you're going to go in a circular motion, in a firm circular motion. And what you're going to do is on every point that you hit up and down your breast, you're going to do soft at first. That gets the skin and the tissue most superficial. And then you're going to do medium pressure to feel the medium tissue in between. And then you're going to go deeper, do firm pressure to feel that deep tissue. And when you feel that deep tissue, you should be able to feel your rib cage. Okay. So what you're going to do is, like I'm showing here, you're going to go circular motion with the flat part of your 3 fingers, circular motion, and you're going to go soft, medium, firm on each spot that you hit. And see how I'm going all the way up, deeper, all the way up, soft, medium, firm, and then I'm working my way back down, soft, medium, firm, soft, medium, firm. And what you're feeling for there is any kind of lumps or bumps, and there can be lumps in either of those tissues that you're feeling for, and that's why it's really important to do the soft, medium, and firm pressure points. Okay. And then once you have done that, you're going to do another one, feeling for any lumps or bumps standing up. And most women like to do that in the shower, just because they feel that it's easiest, because the skin is wet, so it's kind of easier to feel all of that. And so you're going to do that. And once you've done all of that, then your breast examination will be complete. And like I said, if you don't find any abnormalities at all that you're concerned about, you need to report those to your physician immediately.
Okay.
Okay? Would you mind testing it back to me?
Yes.
Tell me how you would do it.
So I'd use my 3 fingers and this part of my fingers.
The flat part.
Yeah. And I'd start with soft,
Mm-hmm.
medium, and then firm in a circular motion,
Mm-hmm.
and move up the breast, covering all the tissue in like a mowing a lawn type pattern. Okay. And then I'd want to make sure that I'm getting also in my armpits. And then you said to my abdomen, and then I'd feel my ribs sometimes.
Yeah, so you're gonna go armpits to cleavage,
Okay.
and then you're gonna go from your clavicle down to the beginning of your abdomen.
Okay.
So up and down this way, and then side to side this way.
Okay.
And you will feel your rib cage, like you said, when you go to the deepest part of your tissue,
Oh,
when you're
okay.
doing that firm pressure. But what are the steps? How would you look in the mirror? Like, how would you start the whole process?
So at first I'd start off with my hands on my hips and looking, like you just said, for any abnormalities in size, shape, or color. And then the next thing I would do is raise my arms up and then look again there to see if they're even, any discharge. And then I'd lie down and do it.
Mhm.
And then I would, after doing that, maybe do it after the shower or while in the shower, and again feel this for the same abnormalities while standing up.
Great, yeah. And another thing that I forgot to mention is also any redness, rash, pain, or
Okay.
swelling that you feel in any areas. Those are also abnormalities that you would need to report to your physician.
Okay.
Okay? Do you have any other questions for me?
I don't think so.
Okay, well, I have a little pamphlet here that will show you exactly step by step of everything that I've taught you today. So if you have any questions, you can just refer to that.
Okay.
Okay.
Thank you.
There you go. Thanks so much. Hope you have a great day.
You too.